Hello, another episode of Green Healing Show with Dr. Layne Martin. I actually promised to bring him here because we were so many people in Summit, and now we have this opportunity to talk to him one on one. So, if you still want to be inside the show as a guest, or you want to watch this show, you can subscribe and you can contact me, and I will be happy to have you in the show as well. Okay, we'll start and hope I have you till the end. We are talking about mind and body connection. We recently had a summit for the book The Gap, and Dr. Martin also talked about his own strategy how to open your airway and breathe freely. There is a chapter, there are some chapters inside the book about how to breathe, because asthma and breathing may have other underlying issues, and I'm so happy we can discuss about it today. Welcome to my show, Layne.
Thanks so much for having me.
Yeah. All right, Layne, tell me about yourself. How did you become? I know you are a dentist, and but you are doing other stuff about the airway and helping others um, with this new technology. How did you end up to do what you're doing now?
So I have a very interesting story. So I received a scholarship from the U.S. Navy for dental school, had an amazing career in the military, got out, moved to Manhattan, started a practice from scratch with $2,020 in my bank account. And soon after, I'm in this high-end practice and things were great. And I was teaching and everything was fantastic. I was doing tons of veneers and crowns and smile makeovers. And then I met a buddy I taught with, Victor. And every time we would discuss a full mouth rehab case or a case where teeth are worn down, he would say, I bet you they have an airway problem. Next case, I bet you they have an airway problem. I love the guy, but he got on my nerves so much. I'm like, what are you talking about, an airway problem? And he started to explain it to me. And next thing I know, I'm doing an airway residency with this airway orthodontist named Barry Rayfield. And it was crystal clear that the things that I saw every single day in my dental practice, broken teeth, severe wear, worn down dentition, collapsed vertical dimension, were all signs of a bigger problem, an airway problem, and I missed it. And I was spinning my wheels, and I was like, at that point, I knew there was a problem. I just didn't know how to fix it. And I was miserable because I didn't know. I was doing really high-end dentistry and things were breaking. I finally decided. I walked into my dental practice. I pulled my office manager aside and said, I'm selling the practice. I'm going back to school. And she was like, what? And just like that, I was 45 years old, back in school doing orthodontics and craniofacial orthopedics because I wanted to help fix the problem. And things were great. And then I got a phone call from a friend of mine that a patient of ours, Ron, died. He was 55. He died of heart failure. And he had all the signs and symptoms of someone with an airway problem. He snored, he had high blood pressure, he had acid reflux. However, he also had broken teeth. And at the time, I fixed his teeth, and I didn't know he had sleep apnea. I saw it when I treated him. And I told him to get a sleep test, and he never went. And now he's gone. And that's when I dedicated the rest of my career to helping other dentists and physicians treat this problem. Because if it happened in my office, it's happening in every single office. And that's kind of what we're doing now. I created a company. We invented an appliance. We invented a pillow. So it's a lot of exciting things. But I've had a great career in dentistry, but I pivoted to do what I'm doing now.
That's an amazing story. You know, every time you feel a passion about something, you have to go for it. People have a lot of obligations doing a job that they don't like, or they feel that there is something I have to go for. Like I was a software engineer, then I was a project manager, but right now I'm doing something related to health, functional medicine, and fertility coaching. The moment that you feel that you can help others and save other people's lives, is that's your mission, and you need to accomplish it, because other than that you're not going to satisfy.
Yeah,
Exactly.
and that's a great point. For so long, I was really passionate about doing dentistry, and I made people look great. But now I could help save their life. And that's something that is a gift that dentists and physicians like you have, right? That's a gift to be able to do that and impact not only the person, but their family. I mean, that's a special thing to be able to do. And that's what we do. We're telling so many dentists, I mean, that's a big part of our training. But if you see worn down teeth, that person has an airway problem and you could really help them. And the problem is, it's that it stems from the schools, right? Everything's about teeth, teeth, teeth. Your teeth should touch for 20 minutes a day when you swallow. You need to breathe for 1,440 minutes a day. Your airway needs to trump the teeth. It needs to be about looking at that first and not last.
I like that. I see, in your explanation, you think that airway can be the cause for ADHD or other mental health. Can you talk about it? And do you have any case studies?
So, I met with a cardiologist last week in Florida, and he's seeing a lot of his adult patients struggling because they can't wear CPAP, they can't wear the mask, they're not tolerant, and they're not compliant. And he made a comment. He said, "There's no other problem in medicine like sleep apnea or airway issues that affects every part of your body, whether it's anxiety, depression, diabetes, cardiovascular problems." In terms of ADD and ADHD, so many of the kids that are diagnosed with ADD and ADHD and getting put on stimulants like Adderall and Ritalin, they're just not getting oxygen to their brain. And it's an airway problem. And so much of it is a tonsil and adenoid issue of soft tissue, but a lot of it is anatomy. And I was just on the phone with a parent because her son had his tonsils and adenoids out and he's still having an airway issue. So 51% of kids that get their tonsils and adenoids out still have an airway problem because of anatomy. And if you look at the skulls of a caveman versus what we look like now, it looks totally different, right? We're all narrow, we're all pushed back. No one has room for 32 teeth, and everyone has crowding or malocclusion. It's an airway problem. And a lot of it stems from lack of breastfeeding, industrialized diets. I grew up on Gerber baby food. I wasn't breastfed. And I was a sick kid, right? I had allergies. I was hyperactive. And then I became a sick adult in terms of snoring, sinus problems. And I'm treating myself now. I'm in orthodontics and I feel so much better because that's really the gap. We're going to bridge the gap between medicine and dentistry. And this is the way to do it, by addressing airway problems, utilizing orthodontics to help our physicians really treat that problem. So I know that was a long answer to a question, but so many of the kids with ADD, ADHD, even I would take a guess, some of the kids that are on the spectrum are having airway issues. And it's affecting their prefrontal cortex. They're not able to focus. They're hyperactive. Because think about it, with kids, they're going to go, go, go. As soon as they stop, they're going to crash. With adults, it's a little bit different. We're just exhausted. All of us could be more refreshed.
Unfortunately, these days, kids love processed food. Unfortunately, we give them a lot of cookies, a lot of sugar,
Yeah.
and that's why a lot of them had a lot of teeth problem, and then that end up having the airway issues. What other symptoms you can address to airway? I'm not saying, like, let's say, what other disease?
All of it. So basically, you know, it's interesting. We use a lot of sleep tests in terms of getting a diagnosis. But when I go out with my partners and lecture about airway issues, obviously the sleep test is great for us to be able to get a real proper diagnosis, but I don't need a sleep test to see if someone has an airway issue. I look at their face based on, do they have venous pooling under their eyes, right? Do they have bags under their eyes? Is their chin back? Which means that, you know, if their chin back is back and their lower jaw is back, their tongue is back, and that obstructs their airway. You know, then we look in their mouth. Do they have worn down teeth? Do they have what's called lingual tori? Do they have high vaulted palates? And then also we're looking at their medical history, right? So many people with acid reflux, a lot of times it's an airway problem. People on multiple meds for hypertension, right off the bat, I'm thinking airway problem. You know, diabetes, anxiety, depression. There's so many signs and symptoms. And a lot of times it's just getting a medical history, getting a sleep questionnaire, and then just looking at their face and looking in their mouth. And obviously this home sleep test or a polysomnogram gives us a proper diagnosis. But really, it affects so many different systems in the body. And there's so many signs and symptoms that we're seeing on so many patients. The thing about dentistry is that a lot of patients see their dentist more than they see their physician, right? I have overweight men that hadn't had a physical in 5 years, but they come get their teeth cleaned every 6 months. So that's why we're saying, let's get every dental office, every dental professional, the hygienist, the assistant, the front desk person trained, so they're going to be able to recognize these things.
What techniques do you use to open the airway?
So basically, it's utilizing, the first thing is we have an appliance. So right now, if someone has sleep apnea or an airway problem, they're going to get one of two things. They're either going to get a CPAP, which is the face mask, or they're going to get what's called an oral appliance. Now, both of those things fix symptoms, right? My argument to a lot of people is, how do you give a 30-year-old an adjunct for 60 years? That's not acceptable medicine or dentistry. So really what happened is, and the reason I went into orthodontics was, the more I did research on it, I realized that orthodontics was really a way to grow the airway and really improve the anatomy. Because so many of us, including myself, I have an anatomical problem, right? I'm a fit guy. I work out all the time, but I was having an airway issue, and mine was based on anatomy. So the orthodontics is really a great way to do it. Things like myofunctional therapy, where you train the muscles. And then it's really a matter of also looking at nasal patency. So it's really a multifactorial problem, but it has to be early intervention orthodontics. No more waiting till someone's permanent teeth are in. Because for kids, think about it, at the age of 3, 4, 5, their tonsils and adenoids are the largest and their jaws are the smallest. So that's when a lot of these kids are really in trouble. And some of the kids get out of the weeds and they're okay, but it's really about intervening early, especially orthodontically.
Wow, these are very informative information. I love that. Informative data. I love that. Thank you. And I just want to know if you recommend any specific diet for opening the airways, or everything is customized.
I mean, it's nothing specific. Obviously, you want anti-inflammatory, right? Like, you want anti-inflammatory, you want things that are not necessarily going to, increase acid reflux, increase heartburn. I mean, I'm a fan of the Mediterranean diet. It's kind of what I use, and a lot of plant-based. I've tried different diets. I mean, like I said, I'm pretty healthy. I eat healthy. I tried keto diet for a while. I never had high cholesterol. I had high cholesterol after. Now, that was my fault I was eating a lot of cheese and replacing things, but I'm a lot of plant-based, and really Mediterranean diet, olive oil, things like that.
You have a website, gelbinstitute.com. What do you do there? Can you explain?
So when I was in my orthodontic program, I noticed that a lot of the adult ortho patients I was treating had significant TMJ pain. And my business partner is a world-renowned TMJ specialist, probably the best person in the world at treating it and teaching it. His name is Michael Gelb. His father is Harold Gelb. The lower night guard is named after them. So I reached out to Michael, and he was so generous with himself and with his time, and he had me come into the office. Long story short, we're business partners, we're best friends. We've created this kind of platform. I equate it to, we've created the Invisalign of Airway. We train every dentist, we certify them, and we give them the appliance that we develop. So we took Michael's and his father's intellectual property of lower repositioning of the mandible, my orthodontic principles, and then our airway principles, and we've created this amazing appliance to really help people open their airway. Now, that's the first part of it because it's treating a symptom. And then a lot of our doctors that are signed up, we really help them fix the problem. And that's where you could use orthodontics or restorative dentistry to build the teeth back up to a proper vertical dimension, which is the upper and lower jaw meet.
You said you have free webinar and masterclass. Can they find it through your website, or do you have another link?
So anyone could go ahead and go on to the Gelb Institute, and it's, there's a part in there that says can be a provider. We're not only training dentists, we're training physicians too, which is great because I think a lot of the physicians, and we have board certified sleep physicians that are part of our company. And there's some great ones. We have Jordan Stern, Jonathan Lown, and Greg Carnival. They're all board certified sleep physicians that really work with us to really help their patients get treated. Because the issue with CPAP, and especially after the recall, it's a compliance issue. So when Michael and I lecture, we always talk about efficacy and effectiveness. Efficacy, ideal in a lab. CPAP, 100% efficacious. The problem is compliance, and that's where effectiveness is really efficacy times compliance, and that's where CPAP is falling a little bit short. And not that we're not believers in it. Michael and I are huge believers in CPAP therapy. The problem is someone going to use it?
Okay. Do you want to add anything, or other than this website, do you have any other communication style they can communicate?
That's really, obviously Michael's written the book Gasp. James Nestor wrote the book Breath, which is really great because it talks about airway problems. It talks about orthodontics. He went through orthodontics to really grow his airway. And that really put us in the forefront in terms of being able to kind of go to the public and talk about these things. Because the fact is, no one walks into a dental office and says, I have an airway problem, right? They're coming in with broken teeth, or they're coming in with snoring symptoms, or they're coming in with jaw pain. And so many of the things that I saw that I missed in my restorative dental practice, like I said, were really signs of an airway problem. And it's like you can't unsee it. I always bring up the FedEx logo, right? If you look at the FedEx logo, between the E and the X is a white arrow. I can never unsee the white arrow. That's all I see. So I never want anyone to unsee broken teeth or severe wear. Those people haven't, and we were taught, like you were, people that clench and grind, it's from stress. You know what? It's stress from suffocating. And that's really the paradigm shift for me and so many of the other dentists that we're training.
As you said, everybody, every part of our body related to each other. Our teeth are not separated, everything in there, even the infections there. So I see even you have fertility issues, it might be your infection in your teeth. That's interesting,
Absolutely.
right? Not everybody really think about it, but there are a lot of disease originates from here. from the mouth.
Yeah, I mean, there's some crazy statistics, right? 50% of the US population snore. 50, right? And there's probably 100 million Americans with obstructive sleep apnea. But the problem is, like, if your child is snoring or they're grinding their teeth, they have an airway problem. No child should snore. No adult should really snore. But when I hear a kid, if a parent tells me their child is snoring or grinding their teeth, right off the bat, I'm like, you got to get them in. We got to take a look at them. Because they're the kids that are walking around with ADD and cognitive issues and behavior issues. And it's not cute, right? It's not cute when you take a picture of your son or daughter in the back seat snoring. That's not cute at all.
Exactly.
That's a problem.
Yeah, and you think maybe they have a cold or there's something wrong with them. But if this happen all the time, so definitely there is airway problem.
Yeah.
So how do you address this for small kids? They can't use, and they just can use puffs, and they cannot put anything in their mouth because they chew it or is not really appropriate for them.
It's a great question. In my ortho program, it's called CTOR. It's Consortium for Translational Orthodontic Research. We were putting palatal expanders in like 5 and 6 year olds, in little kids, and really about intervening early. And there's other things you could do. There's what's called myofunctional therapy. There's things like MyoBrace that really help develop the facial musculature. But you have to get into these kids early. It's no more like me waiting till my permanent teeth are in. It was too late for me. I already had all those problems.
So how did you solve it for yourself?
Unfortunately, I solved it at the age of 47. I wish I had solved it earlier.
Yeah, so but you already did.
Well, I was someone that kind of fought it, right? I would always need coffee by the end of the day. But the more I kind of got into looking at Airway, the more I kind of got into my ortho program, I was like, damn, I'm having all these problems, right? I was snoring, I was tired, I was getting up to, go to the bathroom in the middle of the night often. That's another thing that, with kids, it's bedwetting. With adults, it's frequent urination. Things like acid reflux. So many of those people, it's not a gastrointestinal problem. It's an airway problem. I always equate it to, I don't know if you remember from school, the Bernoulli effect. It's like increased negative pressure. So I always equate it to, if you go to a hotel and you get into the shower, and the shower curtain gets sucked in, it's negative pressure. So if your airway is small, it causes suction if, your stomach contents come up. So a lot of those people that present with, acid reflux and they're on the protein pump inhibitors like Nexium or Prilosec, a lot of them have an airway issue. And then also looking at their uvula, their soft palate, if it's really inflamed, a lot of that is from, reflux.
Yeah. Thank you so much for being here. I really enjoyed. That's the first time we talk about airway, but along with all these 180 episodes that I had, and that was interesting for me. Thank you, and hope we can have you in other shows and summits.
Yeah, I really appreciate it. Anytime you want me, I will be here.
Thank you.
All right.
Bye. Please subscribe to Frontal Transition channel and order my book, The Gap, in Amazon. Thank you for